Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwanitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I have a guest with me today. We're going to get into some sex therapy conversations today with Kelly. Kelly, I forgot to ask how you pronounce your last name.
It's Ghweinem.
Ghweinem. Kelly
Yeah.
Ghweinem is a certified sex therapist. She is a private practice owner and co-founder of Erotic Intimacy Academy. She specializes in queer affirming therapy and helping individuals and couples with challenges like shame surrounding kinks and fetishes, sex after recovery from substance abuse, trauma healing, discrepant desire, anorgasmia, erectile challenges, and non-traditional relationship concerns. Kelly has been a therapist for over 10 years and is experienced in working with individuals, couples, and families from a variety of backgrounds, sexualities, genders, and relationship orientations. She writes an intimacy and relationship column, for Out SFL and the leading LGBTQ plus newspaper in South Florida. And she is passionate about educating therapists on how to integrate sex therapy into their practice. So welcome, Kelly.
Thank you for having me. I'm excited for our conversation today.
Yeah, absolutely. So, on here, we've talked about various different sex topics, both from a medical standpoint, therapy standpoint, different things like that. But we really haven't had anybody come on from a great queer perspective yet. So, I would love to delve into that with you and just how do you help people get through that? Because I'm sure I'm straight. So, I don't have to navigate that life.
Mhm.
I have several friends in the queer community, but I don't personally have to go through that. So, tell me kind of how you help people navigate that.
Yeah, so I mean, it's different for everybody, right? Like everyone is an individual. But one thing that helps from the get-go is like on my website, in my profiles and stuff, I put out there that I do provide queer affirming therapy. And in on my website, it also mentions that I am queer and a member of the LGBTQ community. So starting off, that helps people feel more comfortable going to someone that is part of the community because going back, what was it in like the 50s? I don't know if the date is necessarily correct, but back in the day, homosexuality used to be a mental disorder
Right.
defined by the community, and so by the mental health community. And so, going to someone that is not going to pathologize things
Mhm.
that are part of your everyday life and that don't have those biases coming in is very important. And so there's just that level of comfort from the beginning. And then
Mhm.
in my office, I'm in a different office today, so you can't see, but my work office behind me, so that people can see, there's different like little symbols that just show that this is a safe space for queer people. And then the work really goes into, um, just different things. So some people who maybe are coming out later in life, being able to talk to them about what their journey to coming out was like later in life, because that is different than when you come out earlier in your
Sure.
teen years, and how something like compulsory heterosexuality really played into that, or like comes into our beliefs about uh, sexual orientation or gender orientation. And so just using different modalities, or not modalities, different research that does support LGBTQ community, and also supports like, hey, maybe this is something that you could be experiencing. Like, what do you think about that? Is it?
Mhm. Yeah, that's fantastic. And I love that, you allow them to know right off the bat that you are part of the community as well, because
Mhm.
I do think that that helps. I know I like when I connect with someone about something and they have the similar experience or at least can relate. So that's really helpful.
Yeah. Yeah, I
Yeah.
found that a lot of people that have reached out for services, that's something that they've said that has been helpful to them.
Yeah, I can imagine. I mean, you certainly have a different perspective than I would have if I was their therapist. So
Mhm.
that I think that's wonderful. So talk to me about the sex therapy that you do. I know that it's not only queer based; it is both hetero and queer therapy.
Mhm.
But so you had said something about like helping people not have shame over their kinks and their desires and stuff. How do you kind of work through that?
Yeah. So one thing that's really helpful with shame, and this also relates back to my experience working in substance use, shame really thrives when you hide it and when
Mm,
you're, you know, like keeping a secret, so to
mhm,
say. And shame does not like when there's a spotlight shined on whatever that thing that you feel shame about is,
mm,
whether that's about like the kink and fetish that you have or about the substances that you're using when you're like
mhm,
trying to not be using substances anymore. And so one way that is really beneficial to dealing with the shame is just talking about whatever it is. So
mhm,
with kink, that could be okay, we're not going to talk specifically about how you engage in the kink or what you like about the kink.
mhm,
Let's just talk about the kink at first. Or maybe even that's too much. So let's talk about a different type of kink, right? This also works with regular like sex therapy if there's shame around any type of like maybe there's shame around being vulnerable or there's
mhm.
shame around um oral sex, right? So
Sure.
just being able to talk about whatever it is step one of being helpful, and then after we're talking about it they feel less shame, they're able to open up more. Now how do you integrate this kink or this fetish into your life in a way that feels like it's healthy and aligned with your
Mhm,
beliefs? And if it's not aligned with your beliefs, we process through that. Like, what does that mean that it's not aligned with your beliefs? Is there a way that you can not engage with this and still feel sexually satisfied, or engage in it and not feel a lot of shame?
yeah, yeah, that makes sense. And how about someone who is in a partnership, if they have a kink that they want to explore, you
Mhm.
guys have talked about it, it's a healthy one, but they're not sure how to talk to their partner about it because it's kind of maybe not something that they have explored together or whatever. How do you, like, start that conversation? What are your suggestions for them?
Yeah, so that is actually pretty big, right? A lot of people, especially when they come for shame around kink or fetishes, they have been hiding it from their partner.
Mhm,
This is something that's just for them. They do it private. They don't think that their partner is going to be into it or that they're going to be rejected. So first, we start off with that kind of same process of like, what does this mean to you? You know, how are you coping with this? And then we talk about, okay, what are the signs that your partner wouldn't be into this? How have you had vulnerable conversations with them before? And then we role play. And this could take like, it's not just a 1-2 back and
sure.
forth. It could take several sessions and
Yeah,
really digging into things. And then we do a role play of, okay, if you wanted to bring it up, how do you think you would bring it up? What do you
mhm,
think you would say? What do you think your partner would say back? Like, how
mhm,
would you respond? So going through that role play and kind of visualization of this is what you might expect from this conversation, and
mhm,
then letting them decide when they want to bring it up, if they want to bring it up. Sometimes, even if it's individual therapy, their partner can come in for 1 or 2 sessions, and that 1 or 2 sessions would really be oriented around having this conversation
mhm.
because the person might just feel safer with having me there and to be able to like prompt them or navigate the conversation if it goes in a way that they are not expecting.
Oh, that sounds awesome. Have you found any benefit in having your clients use like some of the kink questionnaires and such that are available online? Like, hey, why don't you and your partner both do these? And that maybe is a like a starting point for some of these conversations.
So people have actually brought that to me as like, oh,
Okay.
this is something I was thinking about trying. And I'll always like encourage them to do that because it's, they're taking the initiative. And I think
Yeah.
it's a good way for them to talk. There's also apps that you can like
Okay.
download. I don't know the names of the apps, but there is apps. I think, I think it's paired where you download
Okay.
it and then you like answer questions and your partner answers questions, and then it tells you how you're aligned. And
Okay.
that can be really helpful because it's a way for people to have a conversation or start a conversation without it being so personal of like, hey, I'm into
Mm,
this. What do you think? Where it's more just like,
sure.
oh, look at this thing. Or even the app, like you're behind your phones and it's a
Yeah.
little less personal.
Yeah, that makes a lot of sense.
Mhm.
And so in the queer community, are there extra barriers that maybe they have to talk through and work through because of just the society that we live in and the viewpoints that people have?
I think yes, for sure. Some of the things I would say as far as like kink and fetishes, probably not. They're actually more open and
Mhm,
transparent about some of the sexual things that they're into and that each person enjoys.
mhm,
They can have better communication than in the straight community, but some things like, well, let's say one person is out and the other person is still in the closet. That could
mm,
cause a lot of conflict in the relationship. And that's like a barrier. Or one person, maybe they're a gay couple, but then during that time, one person comes out as trans and they start transitioning. And
mm,
then that becomes a barrier because although the LGBTQ community is a community, there is still some stigma and discrimination in the LGBTQ community, and especially against trans individuals. And
sure.
so there are different barriers that can affect people in the LGBTQ community that definitely don't impact the straight community. However,
Yeah.
one person coming out as trans, that also does impact the straight community as well.
Sure. Sure. Absolutely. Absolutely. And I think one of the other things that you mentioned that you work with are non-traditional relationships. Talk to me a little bit
Mhm.
about that. What do you see?
Yeah, so non-traditional relationships would be something like an open relationship, or a poly relationship, or as we like to call it, ethically non-monogamous, where, they're not necessarily following the traditional, like we get married, we're monogamous, we have kids, and
Mhm.
then like we live together. They navigate the relationship in different ways. Maybe they have a don't ask, don't tell policy where they can sleep with other people, but they don't talk about it. Or maybe they are a polyamorous couple or it's a throuple where three people are in this relationship together and they're trying to figure out how to navigate it. Or maybe it's a monogamous couple that is now entering into the world of ethical non-monogamy, and um how do they navigate that? But it's also things like co-parenting. Maybe they, were in a relationship, but now they're no longer in a relationship, but they still need to figure out how to co-parent and have some sort of relationship, not intimacy, but they have to
Mhm.
be able to get along to raise their child. So those are some non-traditional relationships and issues that we work through.
Yeah, that's very interesting. Do you find that um, it's that couples who are interested in the ethically non-monogamous, for example, are they are usually both parties on board and both parties not on board, or do you have to work through like one party who thinks it might be a good idea and one person who doesn't? Like, how does that kind of navigate?
Yeah, so it depends, right? Like it really depends on how they're coming in. A lot of times when they're going from monogamous to non-monogamous, and they're coming to see me, one person is on board and one person's not on board, and
Yeah.
then navigating like how to do that. There's been a couple instances where both people are on board, but they're trying to figure out how to do it in the best way possible.
Hmm.
And but the majority of people, it's like one person really wants this, and one person is like, I don't think this is a good idea.
Yeah, yeah, I'm sure that's very difficult. Do you find that the partners that, or the couples, individuals that participate in kind of the lifestyle, is that, do they have healthy relationships? Can you have healthy relationships and ethically non monogamous?
So you can have healthy relationships in an ethically non-monogamous relationship. I think that, defining healthy relationships by the people that come to see me is a little difficult because generally people are coming because they're in distress and
Sure.
they don't necessarily have the healthiest relationships and they're learning how to have healthy
Mhm.
relationships. But I have seen a lot of couples who, when they start sorry, when they start the relation that like going from monogamous to ethically
Mhm.
non-monogamous out of respect, and they have boundaries and they each are listening to each other's wants
Mhm.
and needs in this and respectful of that and really have open and transparent communication and a lot of trust, that
Mhm.
they are able to have a healthy relationship. But for example, let's say one person suggests that they want to have an open relationship because they met somebody else and they want
Mm.
to be with that other person, you're kind of just saying that you want to open the relationship in order to not have an affair, but you
Right.
don't really want to have an open relationship because then there's a lot of feelings if your partner has an open
Right.
relationship too. So there's a lot of nuances that go into navigating ethically non monogamous relationships. I do think it's possible to have a healthy relationship in that dynamic. I also think that it's really difficult because we are raised in a heteronormative society where monogamy is the standard. That's how
Mhm.
we learn about how to have a relationship. And so it's not as easy to then say, okay, I'm going to flip the script and now have this relationship that's completely different and trying to like build the rules without having much guidance.
Yeah, and I have several friends that, participate in various, forms of the lifestyle, and, how their communication is amazing. I mean, the level of connection and communication that they have is far superior than some of my heterosexual couples that are
Mhm.
not non-monogamous, and I think that that can be a really good benefit. I know personally, I just can't share, I'm not good at that, I don't think I passed kindergarten, but I do think that, like I have friends and they have a lot of fun. They go to different parties and things like that. But I do also know that a lot of them, they're back to the shame part. I don't know if it's really shame or not, but just that it's not accepted in society as well. And
Mhm.
so they have this wonderful part of their life that they're both on board with and happy with, but they don't share that with their families. Their closest friends know, but not everybody knows. Nobody at work knows, and I feel like that's unfortunate that they can't just be who they want to be.
Yeah, because if they, especially let's say their family, right? Maybe their parents are a little bit older, or maybe they come from like a background where it's like, I don't know, everyone just kind of gets married and like has a
Mhm.
monogamous relationship. And so then like they're the people that are doing things differently. And that's always kind of a source of contention among families. And it could be they don't want to explain it to their families, right? Like, cause then
Mhm.
it's involving their families in their sex life. And they're like, we don't really want to do that.
Yeah, yeah. I know for me, I've been divorced and I was the first divorce on either side of my family, like not only my sibling and my parents, but like all my aunts and uncles, my grandparents, like I was the first divorce. And so that was a really difficult conversation for me to call and tell people and go through because my family just never experienced that. People stayed married forever. And so I can only imagine, and divorce is so accepted in our society.
Mhm.
So I can only imagine that being in a different type of something that is not very accepted, how much more difficult that would be to let outside people into your circle.
Yeah, absolutely. I think it's always difficult when there's a someone that is like you know, um, someone that does something different in a family. They always have the hardest time doing it, like at first.
Yeah, yeah, for sure. So, what are some things that you can kind of talk to our listeners about as far as just kind of some general sex questions that they might have, as far as, just how to start conversations with their partner, and make things a little bit spicier or take things to the next level?
Yeah, so I would say, that open and transparent communication is so important. And I know that we always hear like when people go to therapy, they're like, oh, what are you going to therapy for? And it's like to work on communication. And that can mean so many different things, but really having a space where you can communicate openly with your partner. And what that means is like you're talking to them in a respectful way, they're talking to you in a respectful way, but you're not afraid that if you say something that it's going to blow up the relationship or this
Mm-hmm.
person is going to have a very negative reaction. You can say it and then they're going to respond to it in an emotionally stable way, and it's not going to be just like this reaction to whatever emotion is coming up.
Mm-hmm.
That takes a lot of work, and that takes a lot of knowing yourself, knowing when you're getting activated, and also like being able to calm yourself down if you're getting activated. And like having a partner that's on board, because let's say you're emotionally regulated during the conversation but your partner's not, the conversation's still not going to go somewhere. And so
Mm-hmm.
that's really where it's helpful that like a therapist comes in and helps you learn how to navigate that. But that's number one, is like being able to have that open and transparent communication about what is going on. Maybe someone feels like there's not enough sex, or maybe someone feels like they want to try something new. And let's say that person that wants to try something new, they're afraid to bring it up because then their partner will be like, well, where did you learn about this? Why do you want to
Mm-hmm.
try it now? Like, what's going on? And it'll bring up these deeper questions instead of being from a place of curiosity of like, oh, okay, maybe like this would be fun to try. And it's just something that they learned about and they want to try with me. And it's not,
Mm-hmm.
it doesn't become this question of like trust in the relationship.
Yeah. I feel bad for my partner because I'm probably overly sharing, and so, like, I'm always like, "So what's your favorite kind of porn? Like, what do you watch when you masturbate?" Or, like,
Mhm.
"What's the" like, I'm so invasive with my questions. So sure I'm like the opposite of most couples, but this is what I love to do. So this is it comes naturally and easy for me. But yeah, those difficult conversations can be tough. And I have patients in my office that will come in for erectile dysfunction, pain with sex, different things like that, and they'll bring their partner with. One of the biggest ones is premature ejaculation,
Mhm.
and the I in my community where I work, there I have a predominantly heterosexual couples, and so the wife will come in and think it's her fault and she's not doing enough, and he doesn't love her anymore, he doesn't find her attractive anymore, or something like that, and it's that's not the case at all. And
Mhm.
so I am not a therapist, whatever, so I don't have your tact, and I'm just like, oh honey, it's not about you, it's all him, like let me work with him.
Yeah.
But I think, those are some topics too that I can imagine that people come to you for.
Yeah, so definitely premature ejaculation, or unpredictable ejaculation, and erectile dysfunction, pain with intercourse. Those are things that people come to see me for, and it depends on like we really have to do a very good assessment to figure out what is happening. So, a lot of times people will come in and they'll just say, oh, well, it's like anxiety, I'm too in my head. And that might be true that, like, they are disconnected from their body, but also, like, what's happening in that moment? Are you
Mhm,
ruminating and like kind of, we call it playing out the tape to the end and thinking like, okay, well, like this is going to happen, then I'm going to come, and then she's going to do this, and then I'm going to feel this
mhm,
way, and before anything even starts, and then that like
mhm,
activates this anxiety. Or maybe there is some physical stuff going on and you have some anxiety. So when someone comes in for something like erectile dysfunction, we always talk about, okay, have you met with a medical
mhm,
provider? Have you, gone to a urologist and gotten tested? And like, what did those tests say? Have you had your hormones tested? Like,
mhm,
what were the results of that? What were the questions you asked? If that hasn't been done, then like coaching them on how to go through that process, because we want to make sure that we're hitting all of
mhm,
the stuff and not just focusing on like it could be relational or it could be anxiety. Like we want to focus on the biomedical psychosocial aspect of it as well. And
yeah,
oh, sorry, I was just going to say, with the Erotic Intimacy Academy, we teach providers how to integrate sex therapy stuff into their practice. And so, something for like a nurse practitioner learning about, okay, this is like what we do in sex therapy for unpredictable erections, and like this is some things that maybe you could integrate into your
Mhm.
practice based off of like what we know, what research says from like a sex therapy perspective.
Yeah, that's fantastic. Yeah, because my when they come into me, I do the medical workup and then I'm like, "Okay, well, you also need to go to therapy because
Mhm.
I can't help you work through the fact that last time you lost your erection, so this time, like you said, you're playing the tape and you're just automatically assuming you're going to lose your erection this time and I can't help that." And the mental part of that, the psychological part of that, but I can give you the Cialis or the Viagra to give you
Mhm.
that extra blood flow and that little bit of confidence that you're not going to lose the erection.
Yeah.
Um, and I do that, with the pain with intercourse too. Is I can take care of the medical side of it, but there's a huge emotional and psychological side of even letting yourself engage in those activities.
Mhm. Absolutely. I think pain with intercourse is like for me one of the hardest things to treat,
Mhm,
because a lot of times it's been years where,
mhm,
excuse me, where the person has just kind of bared with it and had sex anyway, and then it builds up this aversive response. And but in the same token, like if they try to have sex, it hurts. So why would you
mhm,
continue to try to have sex if it's like physically painful? And the
mhm,
things that they have tried have not been helpful. And even suggesting something like pelvic floor therapy,
mhm.
maybe they're scared to do that because that's also going to be painful.
Right.
And so like working through the fear and the shame around it, but also be like teaching someone to advocate for their wants and needs, where it's
Mhm,
like you are allowed to, you know, say no without feeling bad if, if you want to say no. And a lot of women have difficulty doing that. They'll
mhm.
just have sex anyway and not enjoy it, and then do things to avoid sex with their partner.
Yeah, and that can be difficult for both the woman that's dealing with that as well as her partner who's being turned away a lot.
Yeah,
And
absolutely.
and the partner doesn't want to cause the woman pain. I
Hmm.
think that's a big part of it too is they know that, then they start to feel guilty for even wanting to ask for it because they know it causes pain, but that's still something they desire.
Yeah, and they don't really know what steps to take.
Right.
Um, and one thing that can be helpful is simple like lubrication.
Mhm.
And people don't know even like to do that because our sex
Mhm.
education is so terrible in this country
Terrible.
that they don't know to do that. And it's a very
Mhm.
simple intervention that can really reduce pain.
Yeah, absolutely. Yeah, and I utilize pelvic floor physical therapy a lot for my
Mhm.
patients as well. One of the other things you talked about is post trauma. So, whether that would be sexual abuse, which I'm sure is the majority of it, or just any type of physical, emotional abuse. Um, uh, Gosh, how do you work through that with people to allow them to enjoy something again that was such a traumatic event for them?
Yeah, so the framework that I use is from Dr. Holly Richmond. She has this book. It's called Reclaiming Pleasure, and in, so it's working through like the shame that you feel around the experience that you had. This is for like if it's a trauma, a sexual like
Mhm,
assault trauma or something like that. And then how do you get in touch with your body again in order to experience pleasure so that that pleasure is not a trigger for the trauma that you experienced. And so it's really about talking about how does this show up in your body now? So what are the trauma responses that you're having now? Maybe it is avoidance of sex, or maybe it's um, flashbacks during sex, or maybe it's your body tenses up. So we're talking about what happens in the body when that happens, learning to connect with the body through some mind body exercises
mhm,
and mindfulness based stress reduction. And then we're working through, okay, how do you integrate these practices? So that would be like things that you do alone in a non sexual setting. Then how do we integrate these practices with yourself sexually?
mhm,
And then if you have a partner, how do you integrate them with your partner sexually? And so with trauma work, we don't need to know the details of the trauma to help somebody. We just need to know, okay, how is this showing up now? And then how do we align that mind body connection in order to regulate the central nervous system and in order to reduce those trauma triggers that you're experiencing?
Yeah. And I'm sure that it's multimodality, right? Like if they need the physical therapy to learn the stretches and relaxation, you're also sending them there. If it's an erection issue, that you can send them to us to help with that as well. So that's really interesting to me because I mean, I just know how common it is
Mhm.
to have some type of sexual assault throughout, especially women's lives. And I know the queer community deals with it a lot as well.
Yeah,
And not that men don't, but that, it's to a lesser degree that we know of anyways, probably more than we know because they don't want to tell us about it. But,
yeah.
it's really interesting just how often this happens in society and how many people are affected by it.
Yeah, I think the statistics are it's like 1 in 3 females assigned at birth and 1 in 6 males assigned at birth.
Wow. Yeah,
So
that's a big difference.
yeah,
Yeah.
it's a huge amount of the population.
Yeah, for sure. And then within the queer community, beyond the sexual trauma itself, is just the trauma of people bullying them, making fun of
Mhm.
them. I know that trans community is more recently more accepted, but hasn't been accepted by society for many years.
Mhm.
Even though the homosexual community has been started to, years ago being more accepted. So that's got to be a lot of difficulty to work through as well.
Yeah, so someday, in the beginning of this conversation, we talked about queer affirming therapy. And
Hmm.
a reason that queer affirming therapy is so important and for like queer affirming therapists to know is that like the LGBTQ community has higher rates of anxiety, depression, and suicidality because they experience what's called minority stressors. And that is also for any person of a minority group, not just LGBTQ community. So this could also be people of color or people who, let's say, are like seeking asylum in a country, right? They experience higher rates of anxiety and depression and
Hmm.
stuff because they have different stressors on their lives that impact them, right? So
Hmm.
let's say someone who is LGBTQ, they grew up, they were bullied, maybe they came out to their family and they were rejected, maybe they are gender nonconforming and they haven't been able to get jobs because
Mm.
um, they're not presenting in a way that society expects, so then they are rejected from the job. And all of those things lead to these more instances of like anxiety and feeling
Mhm,
terrible about yourself. And so understanding that demographic of people is going to have higher rates of those things and that you can't like CBT your way out of that. You have to be able to um understand that people's experiences in their lives are directly leading to how they're feeling about themselves. And unless those circumstances or experiences change, then you're not going to be able to just like positive think and like think your way out of it.
right.
And so that's important for like how you're treating people in the community because if you're saying, okay, well, you're anxious and you feel like nobody wants you around and that's a cognitive distortion and maybe a bit of paranoia, well,
Mhm.
no, maybe look at the experiences that they've had in their lives of being rejected for who they are as a person and how that contributes to how they view themselves.
Yeah, for sure. I work with a trans woman who is phenomenal, love her. Hormones don't work for her. They reject in her body. She can't tolerate them. So she presents fairly masculine looking. And, if there's any 5 o'clock shadow or anything, a lot of our patients will refer to her as him.
Mhm.
And luckily, she has done the work and she is very confident in who she is and very accepting of the fact that, look, hormones don't work for her. Unless she is full done in makeup with her hair all done and everything, she presents masculine. And so she is understanding of the fact that a lot of our older clientele don't even really understand the trans community. And so they will misgender her. And luckily she is so phenomenal with them that she just lets it roll off her face, but she also, it's troubling and it's frustrating for her. And, we'll have those conversations, but I can imagine that someone who's just starting that process and hasn't fully found their new identity, and fully absorbed that would have an even more difficult time.
Yeah, I would think so. I mean, I can't speak for everybody, but I would assume that, yeah, when someone, especially when it feels so raw and on the
Mhm.
surface, that it would be pretty difficult to deal with a comment from somebody, especially if you're not expecting it, or if you're at work and you're thinking like, okay, I'm just trying to get through my day, and then somebody makes a comment that like speaks directly to something that is very raw and painful for you.
Mhm. Yeah, yeah, I'm sure. Yeah, it's just fascinating to me how much therapy can really help. I've had therapists throughout my life for various issues, and it's just been so impactful in a positive way in helping me handle things and deal with things. So, huge proponent of therapy. Talk to me about your your erotic intimacy academy and what you offer.
Oh, yeah. So the Erotic Intimacy Academy is an online platform, and it's for general therapists and coaches and medical professionals who work in a more general setting, that maybe they see clients or they see patients that deal with sexual difficulties, but they don't necessarily know how to um, work with them, or like interventions to use, or the
Mhm.
research behind it. So our platform has right now we have a certification going on, and it's called the Sexually Educated and Erotically Informed Therapist or Coach Certificate.
I
And
love
that,
that.
thanks. And that is a group of 11 online courses and 10 consultation meetings where we go over a different topic and teach you about the research behind it and how to integrate that into your practice. So let's say someone is a couples therapist, but they don't have the sexual education training. And we're doing a class on unpredictable erections and unpredictable ejaculation. Then they would learn, okay, so you have this couple coming in, maybe they're presenting in the intake as they have discrepant desire. But then the more that you do the assessment, and these are like the types of questions you would ask, you learn that actually what's happening is he's unable to get an erection or keep an erection. And then that is impacting how they engage sexually. And there's a lot of tension there. So then
Mhm.
these are some of the interventions that you could use, or these are the questions that you can ask them in order to work with them. And then this is the research behind why you would ask those questions, right? And like what it means to, some of it is also like basic terminology and like science behind erections and things like that. And
Mhm.
so we would take, we take that class, and we have 11 of those different ones, and teach people really how to integrate the sexual education into their general practice so that they are more informed, so that they
Mhm.
can help the clients. What we've noticed, my business partner is Sari. She's also the co-founder. We've noticed throughout our years of experience that couples therapists or doctors will refer people to us, to sex therapists, because, well, doctors are another reason, but couples therapists, because they don't have the sexual education to
Mhm.
work through that with the couple. And so we're just giving that information so that these couples therapists who already have a rapport with the couple can learn how to work with them.
Mm.
And if it is something that maybe is way out of their scope of practice, we're also teaching them, when do you refer out? When do
Okay.
you refer to a specialist sex therapist? Or when are you referring to a medical doctor or pelvic floor therapist? How
Mhm.
are you talking to them about how they're going to talk to these medical professionals?
Yeah. Oh, that's amazing. And do you also have any courses at all for those of us who are still wanting to do better in the queer community? Do you have queer education as well?
So we have one course. It's called Unlabeled Desires, and it is about LGBTQ community and different terminology, different issues that can pop up that are specific to the queer community, and how to work. It's not necessarily like how to provide queer affirming therapy through and through, but it is like just some steps that you can take to be a little more queer affirming.
Yeah, I know. Luckily, I have this friend that I work with, and she's been very helpful with me when I've had situations where I'm like, I don't know what to say. I don't want to stick my foot in my mouth, or I don't want to say something inaccurate or wrong or offensive or whatever. Like, how do I have this conversation? And it's been really helpful for me to have someone within the community to be able to have that conversation with, knowing that I truly am coming from a place of wanting to be better and more understanding for my patients. And it's not me trying to like not poke fun, but just like not, you know what I'm saying? Like,
Mhm.
it's not that I'm just trying to be like, oh, hey, what do you do when you're, whatever. It's truly from a place of wanting to be a better provider for my patients, that I'm like, hey, how do I handle this better? Or what should I have said differently? And a lot of the times, even with my own patients, I'll tell them like, hey, this is a newer thing for me. Let me know if I'm saying something wrong or if there's a better way that I should have approached you. And
Mhm.
so welcoming and so honest with me. And I love that about my patients,
Mhm.
that they'll correct me if I'm out of line
Yeah.
or if I say something wrong, which is fine with me. I have no problem admitting that I don't know everything.
Yeah.
But yeah, I think that would be a great thing for me to explore more, as well as your other program, because although I might know the science side of it, learning some of the questions to
Mhm.
help get them either started until they see a sex therapist, or just kind of help navigate some of those situations in a little bit more emotionally supportive way would be great.
Yeah, because there are a lot of things that don't necessarily need, you don't need to see a sex therapist for. You can. It is a very short-term intervention, and some people just don't know that stuff. So our
Yeah.
course really offers the tools for providers to be able to do that.
Yeah, that's fantastic. And then for our listeners that maybe are looking for therapy or something, how can they be in touch with you? What would they benefit from?
Yeah. So if they're looking for the Erotic Intimacy Academy, they can go to www.eroticacademy.net or email at eroticacademy24@gmail.com. If they're looking for sex therapy, they can reach out to me at info@velvetcollective.org.
Awesome. That's great. And we'll put those in the show notes as well for you guys, so you have links to click on. I just really appreciate you coming on, Kelly. These are amazing topics and such tough things to talk through. So I really appreciate it.
Thank you for having me. This has been a fun conversation.
Yeah, absolutely. All right, everybody. We'll see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.